a debate so toxic that medical professionals are afraid to discuss it. We'll assess the findings of the CAS review into gender services for under 18s through the eyes of a frontline GP. We approached a number of professional bodies and individuals, and they didn't want to talk about this on the programme. Surrey-based GP Dr. Talha did agree to speak to us, and I started by asking for his reaction to the report.
The key theme is that institutionally we are not ready to deal with complex gender issues, and culturally we're not ready to deal with gender issues. I think that was the key takeaway that I got from this, and I think that's cemented in my own practice and what others have said also.
What have your own experiences been like when somebody's come to you at the surgery? Presumably often you're the first port of call. How is it dealing with that?
It's tricky. There's a few things to say for this. We're all new to this, I think, and that's fair to say, whether you're the patient going through an identity transition, whether you're the healthcare provider, even the family, I'm sure, would experience this as the patient. And in that circumstance, I'm quite able and open to say, I've made mistakes. I have addressed people in the wrong way that they wish not to be addressed. That's just the communication side of things. What about if we look at medically, what is this field like? One of the key points that's made in this report is there's no long-term proof in terms of what can be the outcomes of some of these interventions. Now, we know the medical side effects of some things, for example, testosterone, estrogen, puberty blockers. We have an idea, but what of long-term exposure? The other key theme that I wanted to take away from this report is this debate has become highly polemicized, and that's with the cultural conversations that are happening right now, but also politically too. So I think we have to take all of these into account. And as GPs, we're all used to treating chest infections, trying to treat the elderly, but this is a new field for all of us.
I noticed there when you were answering, there was a moment in particular where I could hear you considering your words and your language very carefully. And I think that strikes to the heart of this. And actually, it draws out what Dr. Cass said about toxicity. Does it make it harder for you as a medical professional to have conversations with your peers about this because of the difficulty of the debate?
Absolutely. I've heard other colleagues say that to me informally. My job, and all of our jobs, is to provide good healthcare and to not give any judgment, no matter what our own personal opinions would be. Take this aside. There are other people that may, for example, drink alcohol or do other things that we would disagree with, or take drugs, but that is their chosen prerogative to do such a thing. We're not there to judge them for that. Another point I'd like to add to that is more and more of this care is being now farmed out to general practice, as if the NHS wasn't already under enough stress.
When you look back over your medical career and you consider those interactions that you've had with people who've come to you and asked for this kind of help, which ones do you remember?
The ones I remember are where I got things wrong, where I was trying to be appropriate and I was trying to be politically correct, and perhaps I addressed them by the wrong name, or maybe I inferred something that they didn't like about their transition. Not intentionally. My intention is to only help people and to respect them. However, as I said, because this is such a new field, we're all still getting used to it. One personal example I'd like to give you is I once prescribed a medicine for a patient for their chest infection. They then said to me, well, I have to use my birth name to go get it. It adds levels and complexities to this as to the identity that they have and how they wish to be perceived, and the various strata of medical levels that they have to go through to deal with this.
Would you say that young people at the moment who are questioning their gender, who are trying to explore who they are, who need help, would you say they're being failed by the system?
That is a very powerful question, and I think I would not be well versed, frankly, to give you that answer. But what I can say is I think it is important to discuss these things with your friends, with your family. Another thing the report has highlighted, and it's something I have seen from my experience as well, more and more often with the gender identity issues that are occurring, there are coexisting mental health issues as well, whether it's ADHD, whether it's depression, whether it's personality disorder. These things have to be teased apart very carefully and treated appropriately and individually. So again, this comes back to the point and the finding of the report that we don't have long-term management strategies.
What other things would help you, both in the short and the long term, to help you do your job better and help those young people better?
We need guidelines on this. This is a new developing field, and we need the guidelines to work by. One of the issues is, what can GPs prescribe? What is the remit of general practice? And you need the funding to provide the right institutions to deal with these things.
What pathways are open to you at the moment as a GP? So, for example, I imagine that when people come to you, this is something that they've maybe researched online. They might know what they want. So if they come to you and ask for puberty blockers, for example, which have been discussed at length in the report, do you prescribe them? Do you not? Do you refer somebody on? What happens?
It's very, very tricky. And I think beforehand there was the referral to the Tavistock Centre, which shut down, and that's had its pros and its cons of being assessed. Now, as far as I am aware, and I could be wrong, there is no referral centre that we can immediately refer into in the south of England, in London. So we're at a no man's land. So these patients may well have certain feelings that they would like to investigate further. What can we do?
That's Surrey-based GP Dr. Talha Sami.